If you're watching this video, chances are you've decided to sit the Applied Knowledge Test, also known as AKT. Would you like to know 7 top tips to pass the AKT? Hi, my name is Dr. Erwin. I help high performers create habits to lead a happy and successful life. In this video, I'll share with you 7 top tips to pass the AKT. The AKT is one of the components of the MRCGP. So AKT can be taken from ST2 onwards, which is GP specialty in trainee year 2 and above. So the way you book the AKT is to go on the RCGP website and you book it online. The AKT is an applied knowledge test. So you'll have 200 questions and 3 hours and 10 minutes to complete all the questions. The AKT is a theory exam. Ideally, having some GP experience will help you in your preparation, although it's not obligatory. Tip number 1. Timing is key. A good time to sit the AKT is after you've started your GP post, because then the questions will make sense to you and you will know what sort of management that will require for patient, because you've seen patients in primary care and the question of base in primary care. So you will be familiar with a lot of conditions that's managed in primary care. At least 2 to 3 months of solid preparation is necessary to pass the test. When it comes to sitting the AKT, it's important that you know exactly how many questions you will have in the test and how long you will have. So you will have 200 questions, and most of the question will be single base answered question, and you will have 3 hours and 10 minutes to complete the 200 questions. That makes about 57 seconds per question. So timing is important. You need to be going at a good pace so that you complete all the questions. Some trainees have struggled with keeping up with the time because when they practiced for the AKT, they did not use the time pressure. So when it comes to the test, then they were not used and trained to actually complete the question in 57 seconds. So when you're practicing, make sure that you use a time pressure and practice within that time pressure, because then when the test will come, you will find it easy to actually answer the question within the time frame. So you won't have to rush for the last few questions and you won't leave any questions unanswered, because each unanswered question will cause you to lose a mark. Tip number 2, learn from other people's mistakes. The RCGP produces a feedback and examiner's report after each sitting of the AKT. So if you go on the RCGP website, you will find all the report, examiner's report and feedback for each sitting of the AKT. Many candidates do not use this resource, and it's a resource that's freely accessible and so invaluable. This is the examiner's report on the sitting of the AKT. So the RCGP produces an examiner's report with feedback after each sitting of the AKT. It's so important that you make use of that resource, because you'll find that it pays off when you use it. I've used the resource and I went through the examiner's report year by year to see where the candidates struggle and what are the topics that's likely to be reassessed in the future. Because the examiner's report and comment, they give good feedback about how they actually assess how the candidates have done and what they're likely going to reassess in the future. So make use of that resource and go through at least 3 to 4 years of examiner's report so that you can actually address these areas which are likely to be reassessed, so high yield topic areas. Tip number 3, you will find that on the RCGP website there is a AKT content guide. So the AKT content guide, you could see it as a foundation of the curriculum. So this is a curriculum that you will need to know. It sets the level of knowledge that trainees are expected to have. So it is a long document, but make sure that you have a look at the RCGP content guide and read it. Focus on each of the area and have a read of what is the level of knowledge that is expected from a trainee. And once you've read it, make sure that you evaluate your own knowledge and focus on the areas of weaknesses that you have. Each of us has areas of weaknesses depending on what experience we've had. So for example, if you've not had much experience of ophthalmology or ENT, this could be an area of weakness for you. So you need to address that by focusing your revision and covering the subjects of ENT and ophthalmology. What tends to happen is that we focus our revision mainly on areas of strength. So what we do is that we neglect areas of weaknesses and we do it in a rush, or we do spend a small amount of time in these areas. So make sure that you have a balanced revision. You address these areas of weaknesses first and then go through other areas, because these areas of weaknesses would be the areas where you can actually improve the most. Whereas the areas where you already have a good sound knowledge, there's not much that you will get by spending time or effort in these areas. Tip number 4, 80% of the weighing of the AKT is based on clinical domain. So make sure that you spend sufficient time covering all the clinical medicine, because that's a bulk of your marks. So make sure that you spend a good amount of time doing the revision around these topics, because clinical medicine is a bulk of your marks. Tip number 5, don't neglect the 20% of the weighing, which will cover organization, management, and data interpretation and statistics. Although organization and management may sound like a dull subject to many trainees, these are easy marks that you can actually score. So make sure that you cover these areas, such as DVLA guidance, licensing, what is a GMS contract, what is a PMS contract. Do you know the rules about data protection, access of medical record? In terms of data interpretation and evidence, make sure that you refresh your knowledge on sensitivity, specificity, what is number needed to treat, p-value. Do you know what is Labe plot or what is box and whiskers plot? So make sure that you read about these different plots, and it is easy marks that you can actually score if you actually do the reading. Tip number 6, effective reading question. When the examiners write a question, each of the word has a reason behind. So each of the word has some information that the examiner wants to convey to you. So there are some keywords that you need to identify when you're reading a question. Some candidates under exam pressure might not read the question and interpret the question well. So it's important that you read carefully each question and you extract the information that the examiner wants to convey to you. So there are some keywords that you need to pay attention to, such as what's the most likely, less likely, what's commonly, or what's the characteristic cause of, never or always, or they use wording like which one of the following is not. So the question is phrased in a negative format. So if you read this question and you think that you know what you need to answer, but you actually read positive, so you misread the question and you're going to answer the wrong question. So make sure that you read carefully and pay attention to these keywords in each of the questions. Last but not least, tip number 7, make sure that you're using effective learning technique. By effective learning technique, what I mean is active recall, spaced repetition, and learning by concept. So I've done a video about these 3 learning techniques that you can actually apply to help you not only memorize what you're learning, but also to apply this in the AKT. So have a look at the video where I cover how you actually use these learning techniques. So learning by active recall is one of the best ways to learn, because you're using your cognitive ability to use information that you have stored in your brain and apply it. So this is very powerful when you're learning, because what happens is that some candidates, they only revise passively. So they read the guidelines and then they don't actually use the knowledge by actively recalling and attempting question and using and simulating this learning process. So have a look at the video I've made that goes over the 3 learning techniques. So here you have the top 7 tips to pass the AKT. I'm sure you will pass the AKT if you apply these tips, and all the best in your preparation. If you like this video, give it a thumb up and don't forget to subscribe if you've not already subscribed, and leave a comment in the comment section. Take care everybody. Bye bye.